This product contains human factor VIII and von Willebrand factor complex, which are proteins found in the blood that help to clot and stop bleeding. People with low levels of these factors are at risk for bleeding longer after an injury/surgery and for bleeding inside the body. This product is used to temporarily replace the missing factors and reduce bleeding. Different brands of this product have different amounts of these factors, so they have different uses. They are not interchangeable, so do not change brands without your doctor's approval. Some products are used to control and prevent bleeding episodes in people with low levels of factor VIII, hemophilia A, while others are used to treat bleeding episodes in people with low levels of von Willebrand factor, von Willebrand disease, who do not respond to or cannot tolerate desmopressin. Some products are also used to prevent excessive bleeding during and after surgery in patients with von Willebrand disease. This medication is given by slow injection into a vein as directed by your doctor. How fast you receive this medication depends on your dose and how you respond to it. This medication is given in a hemophilia treatment center or hospital. In some cases, patients may be able to give this medication to themselves at home. If your doctor directs you to give this medication at home, read the product information available from your pharmacist before you start using this medication and each time you get a refill. Learn all preparation and usage instructions in the product package. If you have any questions, ask your healthcare professional. If the medication and the solution used to mix it were refrigerated, bring both to room temperature before combining. After adding the solution to the powder, gently swirl the vial to completely dissolve the powder. Do not shake the vial. Before using this product, check it visually for particles or discoloration. If either is present, do not use the liquid. After the medication is mixed, use right away. The dosage is based on your medical condition, weight, blood test results, and response to treatment. Follow your doctor's instructions closely. Ask your doctor or pharmacist if you have any questions. Learn how to store and discard needles and medical supplies safely. Consult your pharmacist. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Humate-P Vial may include flushing of the face, nausea, vomiting, fast heartbeat, burning/redness/irritation at the injection site, fever, chills, and numbness/tingling of the hands/feet. These effects can be lessened by giving the medication more slowly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, if you experience signs of anemia, new or worsening bleeding/bruising, or serious blood clots, it's important to tell your doctor right away. Additionally, seek medical help if you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects, contact your doctor or pharmacist. Before using this medication, be sure to let your doctor or pharmacist know if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions. Make sure to also inform your doctor or pharmacist about your medical history. Some factor VIII products may require monitoring of your heartbeat during treatment. If your heart starts to beat faster, it is recommended that you give this medication more slowly or temporarily stop the infusion until your heart rate returns to normal. This medication is made from human blood, so there is a very small chance that you may get infections from the medication. During pregnancy, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that can affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Remember not to start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Humate-P and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share Humate-P Vial with others. Your doctor may also schedule lab tests to check your factor VIII levels, von Willebrand factor levels, and clotting tests while you are using this medication. Make sure to attend all scheduled medical and lab appointments and consult your doctor for more information. Be sure to follow the dosing schedule provided by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Make sure to store the Humate-P Vial medication as per the instructions provided by the manufacturer. Different brands of this medication may require different storage conditions, some can be stored at room temperature while others need to be refrigerated. It's important to ask your pharmacist for more details about the specific brand you are using. Remember not to freeze the product and to protect it from light. After each dose, make sure to throw away any unused portion and keep all medications out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it is expired or no longer needed, and it's always a good idea to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.